Welcome to Talking HealthTech. Today's episode, I'm joined by Jamie Chu from i-scribe. I'm going to throw to Jamie now just to give us an introduction and tell us a little bit about who you are and what you do.
Morning, Sophie. Thank you for having us here. So my name's Jamie Chu. I'm an ophthalmologist working in Western Australia, and I'm the co-founder, or one of the co-founders, and the chief operating officer for i-scribe.
Awesome. Can you tell me a little bit about your journey to ophthalmology and then how that has led to, what drew you to medical AI?
For sure. So journey to ophthalmology, when I was a student, I was really drawn to the tech in ophthalmology when we were doing rotations as students. And I thought, what is this? There's actually a surgeon who's actually using both feet, both hands, looking down a microscope, operating on this tiny little eyeball. And then within about 10 minutes, the patient could see a lot better. I thought, oh, wow, this is pretty cool. I've got to find out more about this. Then I found out that in ophthalmology, there was a lot of technology that was part of the work. And a lot of it was in-house. And so I've always been interested in tech. So that drew me down the ophthalmology path. And then in terms of AI, well, I've always been trying to see, what's the latest in terms of clinical applications? And in ophthalmology, there's certainly been a lot of work, for example, looking at using AI to help screen for diabetic eye disease. And there's some recent advances in that through Moorfields University, which we've heard about recently, which is great. But with generative AI, I guess some of my colleagues and I, when that first came out, saw the potential of how this could actually just help our daily pain points. We, in clinical work, didn't like writing letters. No one likes writing letters. Right? I don't think any doctor or any clinician goes through all of their studies to then write letters or write reports. So it's a common pain point. And so we just wanted to build something for ourselves initially, just so we could get back a bit more pajama time or just not have homework to take home. So we built something for ourselves, and then we iterated that as a group of specialist clinicians, and then we started working with computer science engineers as well, and then we came up with i-scribe, and then we thought, we can apply this and help a lot of others.
All right. So when we talk about i-scribe, we're talking about a medical scribe, so helping with patient notes and I guess writing your patient notes. So there's quite a few on the market at the moment. What sets you apart from the other AI scribes that are out there?
In terms of our team, I'd say that that's a big part that sets us apart. So in our team, we have over 150 years of consultant level private practice experience or senior medical specialist experience. So that is something I don't believe any other teams in the market has. And what that means is that we really get it. We really understand healthcare, the barriers, the opportunities at all levels from actual working experience. And we're also currently all working clinicians. I think that's another big aspect that sets us apart. And so with this technology, we find that, it's fantastic in a lot of ways and has huge potential, but the difficulties can be actually in the implementation of it. And the implementation of workflows is very different for each individual clinician, we would say, and also for each individual clinic or each individual setup, or just depending on what other suite of applications they have, depending on what staff they have, what their workflow is. And so being a team of clinicians, we get that, and we can anticipate what these clinics need and what clinicians need. And another part that sets us apart, I would say, is really in our outputs in terms of the accuracy and the relevance of the letters that are produced, of the medical notes. We've carefully tooled that and iterated that with a lot of clinician feedback over the years. And I guess that's a big advantage. We're just that cycle of iteration and improvement, which is going to happen with any new technology. We've been able to do and can continue to do it at quite a rapid rate. And the feedback we've had from consumers is that they find that our outputs are very accurate, and the most accurate in the market is the feedback we have. And the feedback we've had is that it's more medically intuitive for what they need. So that's great to hear. And I say that sets us apart as well.
Yeah. So I certainly was very impressed by the clinical resume as I scrolled through your team on the website. When it comes to like your team, is the experience in there is incredible from a clinician point of view. But when we're looking at, I guess, the output is being given to the patient, you've spoken a little bit to that, but how does i-scribe really impact the patient experience?
So what I see here as an opportunity for the patient experience is we can take back, increase our role as that clinical expert and the patient advocate. Because right now, patients aren't getting enough information. They're going away and they're going to the internet. And then sometimes they're going down pathways which then become less helpful. Whereas now, if we give them timely, appropriate, relevant information that they take away from someone they already trust, then they don't have to go to the internet. They've got enough information to feel comfortable and engaged about what the next steps are and about their diagnosis. They've got enough to be able to share with their friends and family. This is transformative. I mean, I know of one or two doctors in the hundreds of doctors I've spoken to who write an individualized patient letter, and they were exceptional. I mean, no one has the time to do that, to write a separate letter. And many clinicians at the moment do send a copy of the letter that they send to, let's say, a referring GP or a colleague to the patient, which is great. But I mean, we talk to patients and patients go, I need to Google every third or fourth word. So it's better than nothing. I mean, but we can be so much better. And so with i-scribe, there's a separate patient letter that's produced instantly. And what I've done in my clinic is I handed it out, especially when I've been out in the rural, remote areas, and patients love it. And one of the patients said to me, or said to the reception staff on the way out, they're like, oh, how did the doctor type so quickly? It's because they're at the front desk and they're presented with their next appointment card, but then they're also presented with this like beautifully formatted letter that actually has a summary of that interaction that they've just had like a minute ago. And they're blown away. And so we extended that and we conducted research. So we surveyed a group of 250 patients in an ear, nose and throat clinic and an ophthalmology clinic. They all received an i-scribe letter, a patient letter, and then we followed it up with a phone survey. Mm-hmm. And the results were overwhelmingly positive. Patients love it. And some of the comments that come back were, look, when I'm in the consult, if I'm in pain, I just don't remember everything that happens, or I'm so anxious about what's, the diagnosis or what the next stage is, that I walk out and the doctor was really nice and all the staff are really nice, but I can't remember all the steps. I mean, and I think if we put ourselves in the patient's shoes, or if we, most of us have been patients as well. I mean, I would say that I don't remember everything that's said in my medical consult as a patient. And I know medical terminology, right? So if we put ourselves in the shoes of patients, then it's really tricky. So patients, overwhelmingly said, no other doctor gives this to us, and this is fantastic. I could then share it with my partner. I could share it with my kids. Then they know what's going on. If we just consider it for a moment, like it's really game-changing in that way. And so in a part of our survey, 96% of patients, actually so more than 97% of patients read the letter that was sent to them produced by i-scribe. So that's like fantastic engagement. And I guess why wouldn't they? It's timely. It's specifically crafted for the interaction that they've had. So this research that we did was presented at the RACS, or the Royal Australian College of Surgeons, tri-state conference recently in Broome about a month ago. It was presented by William, one of the ENT service registrars. and I was there as well, and I saw 11 very good presentations, and he won the actual day. So he won that the best presentation at that conference. So that was fantastic. But no, I'm really, really excited about the potential to really transform, the patient experience in that way and what that means for healthcare as a nation.
Yeah, absolutely. And being able to, give patients their information in a way that they understand and that they can refer back and remember that point that they didn't necessarily remember what was talked about in a consult, to walk away and then have it on a piece of paper, to know what the next steps are, and to feel a little more, I guess, in charge or empowered in their own health journey is a big step forward, especially if they can understand the content.
Absolutely. And, I think we were speaking before together, Sophie, and we were sharing, the experience that, hey, unfortunately, there's still scenarios where patients rock up to surgery and they don't know why they're there. They go through the checks. Oh, yeah, Mrs. Jones, why are you here today? What surgery are you having? Oh, I don't know. I'm here because the doctor told me to be here. And, we got to be better than that, right? We can be. And I think that, as you're saying, engaging patients more with relevant information for them is a great first step to improving that.
Well, it's great to see you're out there doing it and providing patients with something really tangible. If we step back again and step back into the clinician's shoes, what factors should clinicians consider when they're choosing some medical AI software for their practices?
So the first important feature or fact is, where is the data stored? So with Australian privacy principles, it's against the law to send any patient data overseas. So something like, for example, with i-scribe, all of our data is stored in Australia on secure Microsoft Azure servers in Sydney. So that's an important consideration. So asking, well, where is the data stored? Secondly, how was the actual, what is the, accuracy of the software? So I think that most people have now heard about hallucinations and how, for example, people using ChatGPT will find facts made up. So it's important to, assess a tool to see, well, how often or does it actually make things up? And I would say that, certainly with our tool, it's very, very rare for that to happen, if at all. And often when it does happen, it's due to the clinician not being clear about what their plan is. So part of it is, we see that as also our role of helping to educate the community on how to use these tools to maximize that efficiency, really, or maximize the effectiveness. So I'd say that they are really important factors. Support is a really important factor. So things go wrong with any software or any technology. So being able to reach out to the company, to the vendor, to be able to have that support. And that's a big part of our team. So we have business development managers and we have support staff on the ground in most states, and an ability, we have a phone line and ability just to reach out to us straight away. And we find that that's important for clinicians because, being as working clinicians, we understand how important the minutes are, or even 30 seconds is in the clinic.
All right. So we've got our clinicians have chosen to use a scribe tool. They've gone through the initial implementation and the frustrations in trying to work out how to fit it in their workflow. That often can have some challenges. How does medical AI and particularly scribing tools contributing to reducing burnout in our workforce?
It's a really common story we hear, of clinicians just suffering from the weights of paperwork. So with using a tool like ours, a scribing tool, we see case studies of clinicians saving up to 12 hours a week of reduced paperwork time. So I have a friend who's a cardiologist, and she was saying to me, Jamie, you have changed my life. Since using i-scribe, I'm saving 12 hours a week. I mean, that's just remarkable, isn't it? I mean, 600 hours a year. getting that time back and still being able to produce the documentation that's required. I mean, she's still overseeing and reading through all of these notes, making sure that she's happy with what is being recorded and what's being sent, because, of course, the clinician is still responsible for the output of these tools. And we very much say that as part of our training with all of our users. And I mean, for her, it's just life-changing. I mean, she's able to spend more time with the family. She's able to actually enjoy the consultation process a lot more. And we hear that story from a lot of our other users. They say, "Oh, look, Jamie, we're actually enjoying the interaction now. I can actually look at the patient instead of being stuck behind the keyboard. The patient seems a bit happier because they're not staring at my back for 70% of the consult. And they're more engaged, and it's just brought that joy back into consulting." And so it's not only about time, but it's also about the experience in day to day. So I think that that's been a big benefit of using the Scribe tool. And really just, I mean, even if you get back half an hour a day, I mean, it means a lot. It means that people can go home on time. It means that they can get to appointments for their kids or their partners, or they can get to the tennis court. I mean, I love tennis, so I'm quite obsessed with playing tennis. So that's my side exercise gig, I suppose. But I mean, it just means that whatever is best for that clinician's well-being, they're now able to do. And they're not, even when I was at the RACS conference in Broome, I was meeting clinicians who were sitting by the poolside writing their letters. I mean, it seems crazy, but this is not an uncommon story. It's not an uncommon story for clinicians to be taking their letters home, to be writing them between 10 and 12 o'clock at night. Interestingly, we receive a lot of inquiries around that time. We receive website inquiries saying, "Oh, I'd like to find out more about your tool." It's midnight. Like, why are you up thinking about AI tools? Probably because you're writing your letters and thinking there's got to be a better way. And so that's how our tool can really help reduce burnout. And we know how important it is for everyone in any field to have their off time, to then be able to be more effective in hours. And so that's what we're trying to achieve with our tool.
Brilliant. i-scribe for pajama time and tennis time.
Absolutely. I like it. Maybe we'll put that onto our next post. I like it.
So what's next? Where does the future of this medical AI lie?
It's such a rapidly moving field, right? So in terms of, for our product, we're continuing to iterate and add features, and we take on board a lot of user feedback. So we've recently launched a tool called an adjuster tool, where you can simply just talk to the system and just speak out in natural words what you'd like changed in the documents. We're now able to offer more flexibility of templates as well. So different kinds of documents can be effortlessly produced. But where else in the future? I see that this kind of tool has great applications for broader clinical research. I mean, a lot of research that's done. I mean, I did research I've got a master's of philosophy, and back in the day, I did some research on the real-world impact of treatment of macular degeneration with injections in the eye. But it was painful. I mean, a really worthwhile process. I'm very grateful for what I learned, but it was a painful process to go through all the documentation that was required for research. So I feel that there's a real opportunity to use AI in general to really but to make things more efficient so that we can just get through research questions faster. So I think that's an exciting area. Of course, the next stage is some sort of clinical decision making being assisted with AI. Now, that's not something that our tool does yet. We've deliberately not done that because we recognize still that the tech's not quite there and it's just not validated. And I know that there are some other, tools out there that are talking about, being a co-pilot and being to help with decision making. And we feel that that's fraught with issues at the moment because it's just not validated to be reliable in that setting. But of course, that's a fantastic new frontier and would be amazing if we can confidently implement that with good accuracy. So I think that there are some exciting opportunities, but I think it's important that clinicians work in conjunction with software engineers so that they help guide the implementation of these tools. And I think that's commonly a view that's held by some of my other colleagues as well. And we very much feel that as well, because there is patient harm that can occur. And we need clinicians involved to be able to identify that early, ideally before it happens, and then make the necessary changes. So lots of exciting potential, but I think we do need to proceed carefully, but we certainly feel very confident that our application of AI at this stage is really making a difference. So we're looking forward to what the future holds.
Amazing. And if I guess to wrap up today, Jamie, is there one statement or an insight that you'd like to leave with our listeners?
I would say not all scribes are equal. So, try different ones out. That's probably say, and I would say, don't write it, i-scribe it.
I love it. Don't write it, i-scribe it, and get some pajama time and tennis time.
Absolutely. And I think that really let's get some patients more engaged. I think that if I'm serious for a moment, I really do think that using AI appropriately to help educate our patients is really an opportunity for us. And that has to have, and I guess an exciting part is we are doing research to validate how effective that is to improving compliance and improving health outcomes. That data is going to take some time, but I think that that's a real opportunity of let's get the patient more engaged again into their own healthcare with the use of these tools.
Amazing. Well, Jamie, thank you for your time today. It's been wonderful chatting, and look forward to seeing what's next and where to for i-scribe.
Absolutely. Thanks so much for having us, Sophie. Look forward to the next chat.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.